Hey everyone, welcome to another deep dive. Today we're tackling a really sensitive but super important topic, suicide prevention.
Definitely a topic that deserves all the attention we can give it.
Yeah, and we're lucky enough to have this chapter from a mental health textbook to guide us. I mean, it's like having an expert right here in the room with us, so.
That's the goal, right?
Right.
To break down complex topics and make them accessible to everyone.
Exactly. So let's dive right in. One of the first things that kind of blew my mind in this chapter was the fact that suicide isn't actually classified as a mental illness.
Right. It's considered a behavior instead.
Yeah, and that was news to me. I always kind of lumped it in with things like depression or anxiety.
It's an important distinction to make, though. Thinking of suicide as a behavior helps us see it's not a diagnosis in and of itself, but rather the result of a ton of different factors all kind of coming together.
It's almost like a fever, right? The fever itself isn't the problem. It's the underlying illness that's causing it.
That's a great analogy. It really helps to put things into perspective.
And it makes you think about how our understanding of suicide has evolved throughout history, too. You know, the chapter mentioned how in ancient Greece it was actually seen as a crime.
Oh, yeah, I remember that. It's pretty wild to think about now, isn't it?
Imagine being punished for something we now recognize as a mental health crisis.
It really shows how far we've come in understanding the complexities of suicide, but also how much stigma and misunderstanding still exists.
Definitely. So let's shift gears a bit and talk about the scope of the problem. The chapter throws out some statistics that are pretty startling, to say the least.
Yeah, some real eye-openers for sure.
Like, did you know that suicide is the 12th leading cause of death overall?
That's a huge number. And what's even more heartbreaking is that for periods after the Iraq War, more soldiers died by suicide than in actual combat.
Wow, that's a powerful reminder of the invisible wounds that trauma can inflict.
Absolutely. It shows just how important mental health is and how we need to be talking about these things more openly.
Speaking of breaking the silence, the chapter has this myth-busting multiple-choice question that I found super interesting. Most people think suicides are mostly from drug overdoses.
Right, but actually the most common method is firearms.
Oh, wow. Yeah, that's a game changer in terms of prevention strategies.
It highlights the importance of responsible gun ownership, but also the need for easy access to mental health resources.
Absolutely. Because sometimes even just limiting access to lethal means can be enough to save a life.
It's those small interventions that can make a world of difference.
Okay, so let's talk about who's most at risk. The chapter covers a pretty extensive list, and some of the factors were surprising to me. Like, did you know that single people are statistically at a higher risk?
Yeah, it's an interesting one, right?
Mm-hmm.
It really speaks to the importance of social connection as a protective factor.
Makes sense. If you're feeling isolated and alone, it's harder to reach out for help.
It's like having a safety net. If you've got strong connections with friends, family, a community, you're less likely to fall through the cracks.
Totally.
Yeah.
And it's not just about being single either. The chapter also talks about how men are more likely to die by suicide, even though women attempt it more often.
That's a complex one, for sure. There are a lot of factors at play, like societal expectations and access to resources.
It seems like men might be less likely to talk about their feelings or seek help when they're struggling.
Exactly. And they often choose more lethal methods, which is why it's so important to encourage men to open up and reach out for support.
Couldn't agree more. And it's not just adults either. The chapter highlights this really alarming rise in self-harm among young girls.
It's heartbreaking to see. That really speaks to the pressures young people are facing today, especially with social media and bullying.
We need to be having these conversations with young people, letting them know it's okay to not be okay and that help is available.
Creating that culture of support and understanding is so important.
Absolutely. The chapter also dives into how socioeconomic factors play a role. Financial strain, unemployment, even living in a rural area are all linked to higher suicide rates.
It highlights how interconnected things are. If you're struggling to make ends meet, it's hard to prioritize your mental health.
Right. It's all about addressing those social determinants of health, making sure everyone has access to resources and support.
Exactly. And speaking of access, there was this really shocking statistic about suicide rates doubling among Black children.
Yeah, that was a tough one to read. It really speaks to the systemic inequalities that exist and the need for culturally competent care.
We need to be advocating for equitable resources and support systems for everyone, regardless of their background.
Couldn't agree more. And I think it's important to acknowledge that there are a whole host of other risk factors, too. Things like mental illness, previous hospitalization, family history of suicide being part of the LGBTQ plus community. It's a complex web of vulnerability.
It's important to understand not just who is at risk, but why. And that's where the chapter gets really fascinating because it delves into different theories that try to explain the why behind suicide.
Okay, so we're going beyond just the facts and figures and trying to understand the motivations and causes, right?
Yeah. Exactly. We're looking at it from different angles, psychological, sociological, even biological. Each theory offers a unique perspective on this really complex issue.
I'm intrigued. What are some of the key insights from these theories?
Well, for starters, the psychological theories focus on internal factors, like internalized anger, hopelessness, shame.
So it's about understanding how our own thoughts and feelings can contribute to a sense of despair.
Exactly. Then you got the sociological theories, which look at the influence of social structures and connections.
So, like how our relationships and our sense of belonging can impact our mental health.
Exactly. One of the most interesting ones is Durkheim's categories of suicide. He called them egoistic, altruistic, and anomic.
Okay, those sound pretty technical. Can you break those down for me?
Sure, basically he categorized suicides based on the individual's level of social integration. Egoistic suicide is about isolation, feeling disconnected from society. Altruistic suicide, on the other hand, is about excessive integration, where someone sacrifices themselves for a perceived greater good. And anomic suicide occurs when societal norms break down, leading to a sense of confusion and meaninglessness.
It's fascinating how those categories connect suicide to our sense of belonging and purpose within society.
Right. It shows how our social environment can play a significant role. And then there's the three-step theory, which links pain, hopelessness, and connectedness. It suggests that when pain and hopelessness exceed a person's sense of connection, suicide ideation can become active.
Wow, so it's like reaching a tipping point where the negative emotions outweigh any sense of hope or belonging?
Precisely.
Yeah.
And it highlights the importance of fostering strong social connections and providing support to those who are struggling.
Absolutely. But it's not just about societal factors, right? The chapter also explores biological theories like genetic predispositions and neurochemical imbalances.
Right? Our biology, our genes, our brain chemistry can all play a role in suicide risk.
It's like our brains and bodies are constantly talking to each other, and when one is out of whack, the other can be affected too.
Exactly. And it's not just genetics either. The chapter even mentions how things like low levels of omega-3 fatty acids have been linked to increased risk. It's a reminder that mental and physical health are intricately connected.
So we've covered a lot of ground already, from understanding suicide and its history to exploring the risk factors and different theories trying to explain it. But I'm curious, what can we actually do about it? Where do we go from here?
That's the million-dollar question. And luckily, the chapter shifts gears to focus on prevention. It dives into the role of nurses, but also emphasizes that everyone has a part to play in preventing suicide.
So it's not just about healthcare professionals, it's about empowering everyone to recognize the signs and take action.
Exactly. We all have a role to play in creating a safer and more supportive world.
I'm eager to learn more about what we can all do, but before we jump into that, let's take a quick break to let everything sink in.
Welcome back. It's been quite the deep dive so far.
Yeah, we've covered a lot of ground already. It's almost like peeling back the layers of an onion, right?
Exactly. We've explored the historical context, the statistics, the risk factors, and even some of the theories that try to explain why suicide happens.
But now it's time to get practical. What can we actually do to prevent this?
Because awareness is great, but action is even better.
Absolutely. So the chapter shifts gears and focuses on prevention. It talks about the role of nurses, of course.
They're often on the front lines, right?
Exactly. But it also emphasizes that everyone has a role to play in preventing suicide.
It all starts with recognizing the warning signs.
Right, because if you don't know what to look for, you can't really intervene.
And the chapter provides this really helpful mnemonic to remember those key warning signs. I-S path warm.
I remember seeing that earlier, but can you refresh our memory? What does each letter stand for?
Sure. So I stands for ideation, S for substance abuse, P for purposelessness, A for anger, T for trapped, H for hopelessness, W for withdrawal, A for anxiety, R for recklessness, and M for mood changes.
Wow, that's a lot to remember.
It is, but think of it as a checklist. If you notice several of these signs in someone, especially if there's a sudden change, it's time to get concerned.
So it's not about becoming a diagnostician or anything. It's just about being aware and paying attention.
Exactly. And the chapter stresses that sometimes actions speak louder than words. Someone might not explicitly say, I want to die, but they might start giving away possessions or withdrawing from loved ones.
Oh, yeah, those are definitely red flags.
Exactly. Or they might engage in risky behavior like driving recklessly or abusing drugs and alcohol.
It's about picking up on those subtle cues, those shifts in behavior.
Right. And I think the chapter also talked about something called reflected intent and withheld intent.
Vaguely, I remember the terms, but can you explain those a bit more?
Sure. So reflected intent is when someone's actions or behaviors suggest a desire for death, even if they haven't explicitly said so. Like maybe they're writing poetry about death or posting cryptic messages online.
It's like they're sending out signals, but maybe not consciously.
Exactly. And then there's withheld intent, which is when someone might be masking their true feelings. Maybe they're afraid to talk about it, or they're worried about what people will think.
So it's like they're putting on a brave face, but underneath, they're struggling.
Right. And that's why it's so important to pay attention to both what people say, A, and D, what they do.
Okay, so let's say you do notice these signs in someone. What do you do? I mean, the thought of confronting someone about suicide can be terrifying.
It can be. But the chapter provides some really helpful advice for approaching those conversations. The first thing is, don't be afraid to ask directly.
Like, just come right out and say, are you thinking about suicide?
Exactly. It might feel awkward, but it's actually the most helpful thing you can do. You're giving them permission to talk about it to break the silence.
Because often people who are suicidal feel so alone, like no one understands.
Exactly. And that's where active listening comes in. Put away your phone, make eye contact, and truly listen to what they have to say. Reflect back what you're hearing, validate their feelings, and let them know that you're there for them without judgment.
It's about creating that safe space, that sense of being heard and understood.
Absolutely. And then there are practical steps you can take to help someone stay safe.
Look what?
We'll encourage them to seek professional help, whether it's a therapist, a counselor, or a psychiatrist.
Okay, so connecting them with resources?
Exactly. And if it's an immediate crisis, call the National Suicide Prevention Lifeline. They're available 200/7 and can provide immediate support.
Right. That's a good one to have on hand.
And if the person is in imminent danger, don't hesitate to call 911 or take them to the nearest emergency room.
So knowing when to escalate the situation is crucial.
Absolutely. But it's not just about that initial intervention. It's also about offering ongoing support. Checking in regularly, offering words of encouragement, and reminding them that they're loved and valued.
It's about showing up, not just with words, but with actions, too.
Exactly, like maybe offering to run errands, cook meals, or just be a listening ear.
Those little things can make a big difference.
They can. And let's not forget about the family and friends of those who've died by suicide.
Oh, yeah. That's a whole other layer of complexity and grief.
It's true. They often experience a unique kind of grief filled with guilt, confusion, and anger.
So what can we do to support those who are grieving a suicide loss?
Well, the chapter stresses the importance of acknowledging their pain and validating their emotions. It's not about offering platitudes or trying to fix their grief. It's about simply being present, listening without judgment, and letting them know that they're not alone.
It's about creating that space for them to process their emotions, however messy they may be.
Exactly. And they might be struggling with thoughts like, what could I have done differently? Or why didn't they reach out to me?
It's natural to feel that way.
It is. And it's important to validate those feelings while also gently reminding them that they're not to blame.
It's about offering compassion and understanding, not judgment or blame.
Exactly. And the chapter also talks about the importance of encouraging them to talk about their loved one, to share memories and stories.
It's about keeping their memory alive.
Right. Not letting the suicide define their entire life. Remembering those positive aspects, those moments of joy and connection can be incredibly healing.
It's about celebrating their life even amidst the grief.
And I think it's also important to recognize that everyone grieves differently. There's no one-size-fits-all approach to healing.
So some people might need more time and space than others.
Exactly. It's about respecting those individual needs and offering support that's tailored to each person's unique grieving process.
Makes sense. And just like with supporting someone at risk, it's crucial to encourage healthy coping mechanisms, right?
Absolutely. Whether it's journaling, talking to a therapist, or finding solace in creative outlets, those tools can help survivors navigate their grief and find meaning in their loss.
It's about empowering them to find what works for them and to build resilience in the face of adversity.
And connecting them with resources like grief support groups or online forums can provide a sense of community and shared understanding.
That sense of not being alone can be so powerful.
It can. And speaking of support, let's shift gears and talk about the role of healthcare professionals in all of this. The chapter goes into some pretty specific detail about nursing interventions and long-term goals of therapy.
I'm curious to hear what insights it offers on that front. So let's talk about the role of healthcare professionals, specifically nurses. I mean, they're often the ones on the front lines, right?
Absolutely. They're in a unique position to identify individuals at risk.
Because they're interacting with patients on a daily basis.
Exactly. They might be the first point of contact, whether it's in a hospital, a clinic, or even a school setting.
So it's like they have this extra layer of awareness, this ability to spot those subtle signs that others might miss.
Yeah, and the chapter really emphasizes that it's not just about recognizing the signs, but also knowing how to respond effectively.
So what does that look like?
Well, for starters,
Yeah.
it's about understanding the different levels of risk.
Okay, can you elaborate on that a bit?
Sure. So the chapter talks about the importance of distinguishing between suicidal ideation plans and attempts.
So it's not just a yes or no question, like, are you thinking about suicide?
No, it's about digging deeper, understanding the nuances of those thoughts and the level of risk involved.
So, like, someone might have fleeting thoughts of suicide, but no concrete plan or intention to act on them.
Exactly. Where someone else might have a detailed plan and the means to carry it out. Those are very different scenarios requiring different levels of intervention.
It's about assessing the urgency of the situation and tailoring the response accordingly.
Precisely. And the chapter also highlights the importance of distinguishing between suicidal self-injury and non-suicidal self-injury.
Okay, that's an important distinction. I think a lot of people get those two confused.
Yeah, it can be tricky. So suicidal self-injury is, as the name suggests, intended to end one's life.
Right.
Non-suicidal self-injury, on the other hand, is often a way of coping with intense emotions, like anxiety, sadness, or anger.
It's like a way to release those feelings or to feel a sense of control when everything else feels chaotic.
Exactly. And that's why it's so important to ask clarifying questions, like, what were you feeling before you did this, or what purpose does this serve for you?
It's about understanding the function of the behavior, the underlying need it's trying to meet.
Right. Then the chapter goes on to outline a framework for gathering comprehensive data about the individual's risk and protective factors.
So like their demographics, their medical history, their social support system, their coping strategies.
Exactly. It's about piecing together a puzzle to get a full picture of their situation.
And I'm guessing that mnemonic we talked about earlier is path warm comes into play here.
Oh, definitely. The chapter really emphasizes that nurses use this as a guide to assess for those key warning signs.
It's like a checklist of red flags prompting further assessment and intervention if needed.
Right. And remember, it's not just about what the individual says, but also about those subtle cues we talked about earlier, the reflected and withheld intent.
It's like reading between the lines, paying attention to nonverbal cues like body language and tone of voice.
Exactly. And the chapter even introduces this tool called CASE, which stands for Chronological Assessment of Suicide Events.
Okay, what's that all about?
It's basically a structured approach to exploring the individual's suicidal thoughts and behaviors over time.
So it's not just a snapshot in time, but rather a timeline of events that can reveal patterns and triggers.
Precisely. By understanding the context and evolution of the individual's suicidal thoughts, nurses can tailor interventions more effectively.
That makes sense. So it's not just about assessment and gathering data, it's also about translating that information into actionable care.
Absolutely. And the chapter lists some examples of nursing diagnoses that might be relevant in suicide prevention.
Like what?
Well, things like risk for suicide related to feelings of hopelessness and desperation. Hopelessness related to absence of support systems and perception of worthlessness. Or ineffective coping related to extreme stress and poorly developed coping skills.
So it's about framing the individual's struggles within a clinical context, which then guides treatment planning and interventions.
Exactly. And the chapter stresses that interventions should focus on both immediate safety and long-term support.
Okay, so what does that look like in practice?
Well, it might involve things like placing the individual on suicide precautions with one-on-one observation, creating a collaborative safety plan, enlisting the help of family or friends, scheduling frequent appointments, and establishing a strong therapeutic rapport.
It's about creating that safety net, both within the healthcare setting and beyond.
Precisely. And beyond those immediate interventions, it's crucial to address the underlying issues that contribute to suicide risk.
So things like helping the individual develop more effective coping mechanisms, exploring experiences that affirm self-worth and self-efficacy.
Exactly. And connecting them with therapy and support groups.
It's about treating the whole person, not just the symptoms.
Absolutely. And importantly, the chapter emphasizes the importance of ongoing evaluation and follow-up.
Because suicide prevention isn't a one-time thing, right?
Right. It's an ongoing process that requires vigilance and adjustments along the way.
It's a journey, not a destination. And speaking of journeys, the chapter also talks about the role of psychotherapy in suicide prevention.
Yeah, psychotherapy is a crucial component of long-term suicide prevention.
So it's about helping individuals develop the skills and resilience they need to navigate life's challenges.
Exactly. It's about learning how to cope with difficult emotions in healthy ways, building self-awareness, and fostering a sense of hope and purpose.
It's about giving them the tools to build a life they don't want to escape from.
I love that. And remember, psychotherapy isn't a one-size-fits-all approach. There are many different types of therapy, and finding the right fit for the individual is crucial.
It's about finding that therapist who really gets them, who they feel safe and understood with.
Exactly. But as much as professional support is crucial, it's equally important for individuals to take an active role in their own recovery.
It's about recognizing that they have agency, that they're not passive recipients of care, but rather active participants in their own healing.
Exactly.
Yeah.
And there's so many things individuals can do to cultivate their own well-being and reduce suicide risk. Things like practicing mindfulness, engaging in regular exercise, connecting with supportive friends and family, pursuing hobbies and interests that bring joy, and seeking out resources like support groups or online forums.
It's about building a life that feels meaningful and worth living, a life filled with things that bring them joy and a sense of purpose.
I couldn't have said it better myself.
So as we wrap up this deep dive, I think it's important to remember that suicide prevention is everyone's business.
Absolutely. It's not just about healthcare professionals. It's about all of us being aware, being supportive, and knowing how to reach out for help when it's needed.
Even small actions can make a huge difference.
A listening ear, a kind word, a simple check-in. These things can be lifelines for someone who's struggling.
So as we leave you today, we encourage you to take what you've learned and put it into practice. Let's break the stigma, let's have those tough conversations, and let's work together to create a world where everyone feels seen, heard, and supported. Thanks for joining us.